So my name is Bill and I am a Stroke Safe Ambassador for the National Stroke Foundation. And I'm not a doctor, so I'm not going to give you guys any advice on any specific issues that you may have or you know somebody else may have. What I'd recommend in that situation is for you to contact your GP, the National Stroke Foundation, or somebody else that's qualified to actually help you out and give you that information that you're after. But I will give general information and I will give you a bit of an insight into what we can do to help recognize the signs of stroke, to help prevent stroke, and what to do if somebody is having a stroke. I'll also share a little bit about my story and how it came to be that I'm here today, and some of you might find that interesting. And without further ado, I'll get into the presentation. And I just wanted to say at the beginning of the presentation, according to the World Stroke Organization, 95% of strokes are preventable. So it's a really big number that we're dealing with, that we can prevent, that shouldn't be happening. If there's something that we do that causes them, we can also do something that changes them. And there are a couple of different types of stroke. There is, on the left-hand side of the screen there is the standard or usual ischemic stroke. It's the one that most people hear about. It's the one where a blockage occurs in one of the blood vessels. The blockage could occur from a blood clot. It could also occur from a cholesterol deposit leaving an artery from another part of the body and heading up and lodging itself in a smaller vessel and causing a blockage. When the blood stops traveling through that blood vessel and can't get beyond the blockage, that part of the brain can't receive any oxygen. And the part of the brain that is not receiving the oxygen starts to die. A piece of the brain the size of a pea dies every 12 minutes that it is lacking oxygen. So potentially after only 20 minutes, the damage could be significant. There is another kind of stroke caused by a bursting of an artery called a hemorrhagic stroke. Now, an artery could burst, or it could be a large vessel or it could be a small vessel. And when it bursts, what happens is blood leaks into the brain. And blood is poisonous to the brain when it is outside the blood vessels. So as the brain starts to get infiltrated by blood, what happens is it starts to put pressure on the brain cells that it's surrounding, and those brain cells are not able to receive oxygen as per normal, and they also start to die. So the inflammation that occurs on the outside irritates those blood cells, they stop receiving oxygen, and they start to die. And it causes problems to the person in the same way that an ischemic stroke would cause problems to a person. Now there is another kind of stroke that is a little different but has similar symptoms and side effects, and it's called a mini stroke or a TIA, Transient Ischemic Attack. And the TIA has the same kind of symptoms. People notice the same things that they would normally notice, but the symptoms go away within around 24 hours. And what happens is the symptoms go away, and often people think, well, the symptoms are gone, I must be okay. But often a TIA or a mini stroke is the sign of another bigger, more serious stroke is around the corner. And it's a good opportunity to get checked out by a doctor or a GP to determine what might be the cause of the TIA so that we can take steps to prevent a massive stroke happening later on. Now, depending on where stroke happens, there's different things that are impacted. And on this image, it shows in the different colors, the different parts of the brain that are affected. And in this area, in blue, the vision will get affected. And a person that experiences a stroke there may have permanent or temporary vision loss. Blurredness, double vision, all kinds of things could occur. In this area down here, posture and balance and coordination get affected. So that person often may not be able to walk properly like they used to and may need some kind of an aid to be able to get around. On the other side here, in orange, speech gets affected. And often when somebody has a problem with their speech and they're experiencing a stroke, they may start mumbling or not being able to finish sentences or make words or even understand what you're talking about. And in this area, the hand gets affected. So coordination, somebody picking up a glass of water and bringing it to their mouths may be difficult. And they may also lose strength in their hand. They may not be able to actually pick up that glass at all. They may not be able to squeeze your hands properly. And those symptoms could be a sign that somebody's experiencing a stroke. Now, the impacts of stroke can be very serious. We know that some people will, unfortunately, not recover from having a stroke and pass away. But other people that do recover will experience mobility issues. And I briefly mentioned the difficulty to get around and walk. But mobility affects things like daily activities, where going and doing your chores is no longer something that we can do easily and take for granted. Often people that experience a stroke will need somebody to pick them up and take them to the shops to do shopping and bring them back, depending on the severity of their stroke. Relationships and family get affected. In a moment, I'll share a little bit about what happened to me and the strokes that I experienced and how that affected my family. It was pretty serious because no one in our family had ever known what a stroke was. And now dealing with it was really scary. We didn't know what to do initially. So I'll get to that in a moment. And I'll also share a little bit about how stroke makes people emotional and how it can affect your emotions, and it affects them in a way where it's uncontrollable. I can't even, in my particular experience, I couldn't even control how I was feeling and how I was responding to different things. And it has a psychological impact. 33% of people that experience a stroke will suffer from depression. It's just part of the process. Sometimes it's due to the changes that occur in the brain, and sometimes it's due to the inability for that person to comprehend what's going on in their lives and the sudden changes that they now have to deal with that they don't have the skills to deal with. In Australia, stroke is the second biggest killer. Yet we don't hear a lot about it, and there's not a lot of fun runs, and there's not a lot of activity to raise awareness, raise money to support different campaigns. It's not really fancy or sexy to talk about stroke like it is to talk about other diseases. 1 in 6 people will have a stroke, unfortunately. So 1 in 6 people in Australia will have a stroke in their lifetime. And it's looking like that figure is actually increasing. And that's due to the kind of things that we do to our bodies these days and the type of foods that we've been eating or exposed to. In Australia, somebody has a stroke once every 10 minutes. So there's a massive incidence that happens all the time. It kills, unfortunately, more women than breast cancer, and it kills more men than prostate cancer. And yet we don't hear enough about stroke awareness, how to help people having a stroke, how to help people recover from a stroke, what to do if somebody's having a stroke. And in 2012, there were nearly 130,000 people or 30% of stroke survivors under the age of 65. And unfortunately, that number is also starting to rise, because most of us younger folk, even in their 30s, think they're bulletproof. And they've got habits and they're doing things to their bodies that are causing these illnesses that weren't usually seen very often in people under the age of 65. One day in February of 2012, I woke up in the morning with some numb sensations in my big toe on my left-hand side. It was no big deal because it was just a small, numb, little one toe. And I went about my work. We have a property maintenance company, and waking up on a Friday meant that I had to get to work, see a couple of guys on different sites that were doing different jobs for me, and make sure everything was going well. And a numb toe is not something that I would normally stop and consider to be something that I should go to the doctor for. So I went about my day, and the numbness came and went and came and went. And it didn't really stop me from doing anything, and I felt fine. I felt really well. The day came and went, and Saturday was my day off, so I didn't do much around the home. The toe was still numb, and the numbness was sort of creeping into my foot now. And as it was creeping into my foot, depending on the position I was standing or if I was sitting, the numbness was going away. So I thought it was odd and a bit strange, but no big deal. It's just a numb foot. That particular day went, and Sunday morning was my day going to the gym and having a run on the treadmill. Because I have bad ankles, I don't run on the streets, I run on a treadmill in a gym. So I don't damage my ankles and twist my ankles. And as I was running, I was noticing that my left foot was numb. And it wasn't really coming in and out of numbness, it was sort of staying numb now. And in the past, you would get on the treadmill and run and do your thing and not really have to look down to see where your foot is because you can't feel it. Whereas this time I had to look down and make sure that my foot was in the right place. And as I was putting my foot down and looking down, I was managing to get through the running. And I got home and everything was okay. We didn't have any work again, everything was a little bit quiet. Didn't do much. Woke up Monday morning and decided that I needed to go to work again. I beg your pardon, I didn't decide, I had to go. And while I was at work, I was noticing that the numbness was spreading from my foot all the way up to below my knee. So now my foot's gone numb and my leg is numb below the knee. And I thought, I've done something to my back. Anyone else self-diagnosed before? I'm pretty good at that. I've been good at it lately. So I rang my chiropractor and said, hey, I've done something to my leg via my back and I need you to sort it out for me, because he had been seeing me on and off for 10 years. Every time I did something silly, lift a paint can the wrong way or climb a ladder the wrong way and stretch in weird positions and did something to my back, he was my go-to man. I'd go there and he'd sort me out. So he said, great, make an appointment, come and see me. And on Monday afternoon, I went and saw him. And he said, there's nothing wrong with your foot. And if it's being caused by your back, I can't see any sort of challenges with your back that might have caused that. It might be something that's starting to occur, some inflammation of a nerve or something. Keep an eye on it, and if it changes in the next 2 or 3 days, call me and we'll make another appointment and you can see me again and we'll work out what it is. So I went home, and Tuesday I went to work and the numbness was kind of spreading now beyond the knee, and I was noticing that it was bothering me and it was on my mind rather than sort of, rather than me not noticing it, I was noticing it. Also, around about this time, my wife said, you're walking a little funny. What does she know, right? Ladies, So I ignored her, because when she said, "You're walking funny," well, I imagined that she said that I was dragging my leg, like some ape man or something. And I thought, she's nuts. There's nothing wrong with me. You're dreaming. On the Wednesday, so now we're 5 days after I first noticed the symptoms, I thought to myself, I'll ring the chiropractor because it's now spread to my hip and it's actually becoming difficult to get around and I'm noticing the numbness more. There's got to be something going on. I'll see my chiropractor. By now, whatever was causing this numbness will have presented itself and he'll be able to sort it out. I rang the receptionist and when she answered, she said, "Look, sorry, Bill, but we don't have an appointment until Friday. Is it urgent?" And normally, when I say it's urgent, what they'll do is they'll fit me in on that day. And I said, "No, I don't think it's urgent. I feel quite well. I'm okay. There's nothing wrong with me, except I just can't feel my leg." And she said, "Well, okay. If it's not urgent, we'll make an appointment for Friday." So Thursday came and went, and Friday morning I woke up with the majority of my left side now feeling strange. And I went to this particular job that we had in the suburbs of Melbourne, and I had to get on a ladder to demonstrate to somebody how to go about doing the part of the job in a specific way that I needed it done. And I went to put my foot on the ladder, and it kept slipping off the bottom rung. And I looked down and I noticed that the ground below the ladder was wet. It had some water on it. And I imagined that the reason my foot was slipping was because my shoe was wet and it couldn't stay on the ladder. So I've looked down, I've picked up my leg physically from the knee and I've put it on the bottom rung of the ladder. And I proceeded to walk up the ladder to get the job done and show what it was that I needed to do. Thankfully, I didn't fall off the ladder. When I finished taking the guys through what needed to be done on that job, I jumped in the car and I went into Melbourne CBD, where we had another job and another bunch of guys that I needed to take through their job, and we did that. And as the day progressed, the appointment that I had made around 4 o'clock was coming around pretty rapidly. I was looking forward to going to the appointment, seeing the chiropractor so he can sort out my back, because the next day I had another job to do and I had to make sure that I was well enough to be there. Now, when the day ended and I went to the chiropractor at around 4 o'clock, 7 days after I first noticed the numbness in my toe, within about 30 seconds, he said, "There's nothing wrong with your back. And if you can't feel your left side, you need to go to the hospital right now." And I looked at him and I said, "I'm not going to the hospital. You're mad." And he said, "Well, you have to, because whatever's going on isn't being caused by your back." He didn't want to alarm me, so he didn't say it's probably your head. He just said, "You must go to the doctor." He insisted. And I said, "If I go to the hospital, I won't be able to go to work tomorrow, because you know what they'll do is they'll keep me in, and overnight, and by the time they release me, it'll be Monday. And I've got to be at work." So we ended the conversation and I went home and had a chat with my wife, who asked me what the chiropractor said. And I said, "Well, he said to go to the hospital, but I'm not going." And my wife, puzzled, knowing now that I couldn't feel my whole left side, said to me, "Why don't I just jump in the car and I take her to the hospital?" And I said, "Well, if you take me to the hospital and they keep me in, I won't be able to go to work tomorrow. And there's 15 people relying on me, and the client won't give us another window of opportunity. This is the only day we can do this job. And I've got to be there tomorrow. There's no way I'm missing out." And my wife, being a little bit smarter than me, said, "Well, why don't I take you to the hospital? They'll tell you there's nothing wrong, and then you can come home." And I thought that was a great idea. So off we went. Now when we got there, the doctors asked me how I was, what I was feeling. And when I explained to them that I couldn't feel my whole left side, well, you've never seen them roll out the red carpet like they did that day for me. It was, come through, sir, lie down in a bed, sir, straight through the doors, no waiting for you. And we ended up going through into CT scan. And when we got to CT scan, they scanned my head, and at about 1 o'clock in the morning, there was a doctor available, and he came and told me that they discovered a shadow on the brain. And a shadow on the brain for them is something that they have to investigate further because they don't necessarily know what caused it after a CT scan, but they suspected a bleed in the brain. And the bleed was in an area that was on the right-hand side, which affects the left-hand side. Now the story doesn't end there. I'm going to continue the story once we get through a few more slides, just to give you a bit of an understanding of what happens when somebody's experiencing a stroke and how we can prevent them.
Can I ask how old you were?
Yes, I was 37. The good news is that many strokes are preventable. And we've all seen these different things that the doctors tell us to do every time we go and see a GP. And if we're smokers, they tell you to avoid smoking, because smoking decreases your blood pressure.
Did you smoke?
I smoked.
When did you stop?
I stopped the day after I was told I had a bleed in the brain.
37.
Yes. They tell us to reduce our blood cholesterol and know our numbers. So if we haven't been to a GP, or if we know somebody, children, grandkids, whoever it is, that seem like they might be experiencing these types of conditions that have never been to the GP, we should encourage them to go and get themselves checked out. They'll tell us to control diabetes and know our numbers again around the blood sugar. They'll tell us to maintain a healthy weight, make healthy food choices, be physically active, reduce alcohol consumption, and control irregular heartbeat, which is something I'll touch on in a moment. So these are not new, but often when you go to the GP and they tell you these things, they don't tell you why. What's the benefit of stopping smoking? What's the benefit of maintaining a healthy weight? What's the benefit of increasing your activity? Well, one of the benefits, amongst many others, is that if you do these things, it reduces the risk of having a stroke. Can I see a show of hands of people who know somebody who's had a stroke? More than half of the room knows somebody who had a stroke. And that's very common. That's what I'm seeing at most of these presentations that I do. Now, with regards to controlling an irregular heartbeat, often an irregular heartbeat is called atrial fibrillation. And all it is, and sometimes unfortunately it's diagnosed after a stroke, all it is an incorrect beating of the heart. So instead of maintaining a rhythm, the rhythm chops and changes, and sometimes it stops temporarily. And that change alters the blood flow, and as it alters the blood flow, sometimes there's a potential for blood clots to occur in the heart, and then those blood clots go up into the brain and lodge into the vessels and cause a stroke. So if you know that somebody is experiencing an irregular heartbeat or has heart palpitations or something strange, it's really important to ask them to go and see a GP, to have it checked out, because there's medication they can take and there's also other procedures that can be done to help prevent that irregular heartbeat. And also, as a result, help prevent stroke. Now, having too much salt increases our high blood pressure. In Australia, according to the statistics, we eat 9 grams of salt per day, per person on average, and we should be consuming no more than 4 milligrams of salt per day, per person. Grams, I beg your pardon, not milligrams, grams. And what we're being told is the most likely cause of this excess consumption of salt is from foods that are pre-packaged or bought from fast food outlets, basically foods that we don't make at home. Most of us know that if we cook a meal at home and we add salt to taste. We don't add salt to preserve anything. We don't add salt to mask unwanted flavors or any other things. We don't do what the food manufacturers do. We just add it to just enhance the flavor of the food that we're eating. And a good way to avoid extra salt is to pay attention to the labels of the food that you purchase and to try and minimize the purchase of foods that are manufactured outside of your home, that are pre-packaged, for example. If you are over the age of 45, or if you know somebody who's over the age of 45 and never been to a GP to get anything checked out, this particular form here has a few questions on it. And if you tick a couple of those boxes when you're answering those questions, there's a good reason to go to the GP and just ask to get checked out for your diabetes, your cholesterol, your high blood pressure, just so that you can manage anything that might come up that you're not aware of. And for the younger ones around, like myself, who had never been to a GP, or other people out there that are similar to me that think we're still bulletproof, it could be a good thing to take to them. You can pick one of those up at the end of the presentation if you like. Before I go into the acronym FAST, I want to finish my story and give you guys a bit of an update, because since February 2012, a lot of things have happened. After I was diagnosed initially, I spent 7 days in hospital, and when I went home, I was told that I can't work, I can't drive, basically everything's on hold for a minimum of 6 weeks. And when I woke up around about, the last day of my 6 weeks, I was getting completely bored out of my brains. I hadn't done anything or been anywhere, and I was getting fed up with it. And I thought that I'm going to jump in the car and go for a drive. Now, for some reason, at the last minute, I decided not to go. And instead of driving, I rang a friend of mine to come and pick me up, who was working for me, and he was going to go to a job that I had that was being done in the CBD, and he was going to meet some other staff there, and they were all going to do this job for me. And to get out of the house, I thought I'll go and just supervise them and just be there. So I did. I went along, and while I was there, I started to notice a numb sensation come over my left side again. And I was sitting down in a chair just watching them as they're working. You know how much people love to be watched while they work. And as I was sitting there, I just noticed that my left side was kind of slipping, and I couldn't really control it, and I couldn't stop it from slipping, and I was slowly going down this path. And when I got low enough, I figured, well, all right, snap out of it, whatever's wrong with you, get up. So I got up and straightened myself up and sat properly, and then I noticed it happening again, and now the room was starting to spin and it was getting busy. And I started to slap my face so I can snap out of it and so I can wake up. Now, that didn't work. And the guys were busy painting a wall, and I didn't want to disturb them. So I let them finish their wall and finish the job, which from the time I noticed the sensations of numbness, there had been around about 2 hours that elapsed. And when they were packing up, I said to them, guys, I'm not feeling well, somebody needs to take me to the hospital. And we were in the CBD, and it was around 2 o'clock in the afternoon, and it was a Friday. And on this particular day, there was just a ton of traffic. Peak hour had started early. And as we left, I started to feel nausea, and I started to feeling like I needed to vomit. And we drove from Flinders Street and we came through the city and we ended up outside the St. Vincent's Hospital where I needed to throw up. And I pulled over and I went into the gardens and I threw up outside the car, in the park there, across the road from St. Vincent's Hospital. And then I jumped in the car and continued to drive to Preston, where I live, and rang my wife and told her, I'm on my way home. When I get there, you need to take me to the hospital. So we drive past the St. Vincent's. I'm on the way home. The traffic's chaotic and it takes us an hour and a half to get home. By the time I get home, it's around about 4 o'clock in the afternoon. And my wife is waiting for me to take me to the hospital. The challenge that I faced, other than the fact that I was having a bleed in the brain, was that the people next to me didn't know what to do when somebody's experiencing a stroke. They don't know anyone who's had one and they don't know how to recognize the signs, and they had no idea what was going on. So it didn't ring alarm bells for them to stop at St. Vincent's Hospital. When I told them to keep driving, they kept driving. Now, I'm not in my right mind to make decisions about myself and about how I'm going to help myself. I needed somebody else to do that for me. I couldn't think straight. Anyhow, when we got home, I jumped in the car with my wife and she drove me from Preston to the Austin Hospital, which is in Heidelberg, only about 10 kilometres away. When I got there, in order for my wife to go and park the car, she had to leave me at emergency outside on my own while she parked the car, and then she was going to come back and meet me there. I walked 50 metres from the car to the triage nurse, and when I was asked, how can I help you? I had no answer. I didn't know what to say. When the nurse realised I wasn't speaking much, she asked me what my name was, and I didn't know. She asked me what I was doing at hospital, and I told her, I'm sorry, I don't know. The next thing I remember is waking up, I'm not sure how many hours later, with a whole bunch of tubes and stuff attached to me, in a bed, and the nurses running around like chooks without heads. The bleed had occurred again. I had experienced another bleed in the same spot. And now, instead of the blood staining being about the size of a 10-cent piece, I had a blood staining of around about the size of a golf ball in my head. And it was affecting way more of my body now than how it was before. I was in hospital for another 3 days. And when I came out of hospital, there was no work and there was no driving for at least 9 months. Now I'm going to fast forward by 2 years, 2.5 years almost, to November 2014. And in a moment I'll finish the story because it doesn't end there. And then that'll give you a bit of an insight into what stroke does, how it affects people, and sometimes what the potential for recovery is, because that's really important as well. Had we been in a car with some people that knew this acronym, I may have been looked after a little better on the way to hospital that second time, and my recovery may not have taken as long as it did. This acronym is used worldwide by all the stroke organisations and foundations, and the F stands for face. To recognise if somebody is having a stroke, in around about 80% of the cases, somebody's face will droop on one side. It'll change. It may not be as dramatic as that. There might be some minor changes, but it's usually a good sign that somebody's experiencing a stroke. A stands for arms. Like I mentioned a little earlier, people's arms will often, or one of them, will often become a little weaker as a result of experiencing a stroke. They may not be able to lift their arm up their arms up all the way. They may not be able to bring their arm to their nose, pick up a cup of tea, or squeeze your hand with that arm. S stands for speech. Sometimes the speech gets altered. And when I was in hospital the first time, I came across a gentleman who was making breakfast. And he went to pour the milk into the bowl. And as he went to pour the milk into the bowl, he missed and he was pouring it onto the table behind the bowl. So his arm wasn't working properly. The coordination was gone. And when his wife asked him, "What are you doing?" he started speaking in a different language. It was gobbledygook. It was a language she had never heard before. She recognized that those two things that occurred potentially were signs of a stroke. And she rang 000 and got her husband to hospital. T stands for time. If you think somebody is having a stroke, it's time to act and ring 000. If you speak to the operator and tell them that the person may be experiencing a stroke, they'll send the relevant crew and they'll take the person to the relevant hospital, because we have 4 hospitals in Melbourne that will specifically deal with stroke patients that have stroke wards. If we can get people to hospital within around 4.5 hours after the first signs of stroke, there's a good chance for a full recovery, because they can give medication that will remove the clot and restore blood flow, and also they can give medication to drop blood pressure in the case of a bleed to reduce the bleeding, and operate if they need to. They can take quick action to operate and to resolve that matter for that person. So this is how we recognize the signs of stroke. Before I wrap up the presentation, I'll give you the last part of my experience with stroke. In November last year, after not riding a bike for nearly 3 years, or exercising at all for nearly 3 years, I decided that I was going to go for a bike ride. And I was feeling great, and coming up to that bike ride, I had no major challenges or experiences of the side effects that stroke causes. And I felt really fantastic. On a Sunday, I went for a ride, woke up the next morning, and I had a meeting to go to, but I was feeling amazing. There was no body aches, there was no pains from the riding after 3 years. Everything was feeling great. And as I was driving into the CBD, I started to notice like my hand was sunburned. And I looked down onto my arm and my hand, and I wondered how I could be feeling sunburn when I hadn't been in the sun the day before, and I was inside the car and there was no sun out. And as I looked down, my hand wasn't red, it just felt like it was burning. I kept driving because I didn't think anything of it, and then it started to happen to my leg and my left side of my body. Again, it felt sunburn. I got out of the car, parked the car temporarily, got out of the car just to see if I can walk this sensation off, and I realized that it wasn't going away. At that time, I thought that I was experiencing a third bleed. So what I did was ring the person who I was meeting in the city, tell them that I had to cancel, and drove myself to the Royal Melbourne Hospital. I parked the car, and as I walked in to reception, I went to triage, and one of the nurses asked me, "How can I help you?" And I said, "I'm experiencing a hemorrhagic stroke right now." And she did exactly what you guys did. She kind of smirked and had a bit of a chuckle, and she looked at me strangely, and she thought I was on drugs. Let's be honest. And I said, "No, seriously, I'm experiencing a hemorrhagic stroke right now, and you need to get me inside into an MRI right now." And she said, "Okay, settle down, give me your name, And once she took my details and pulled my file up, she realized that in fact I potentially may have been seriously experiencing another hemorrhage. And once again, they rolled out the red carpet for me. Welcome, sir, come through. You know, here's a bed for you, straight into the scanning machine. And normally when you go into a CT scan, hopefully you've never been there, but when you go in there, there is 1 or 2 people hanging around you. Now this time the room was full of radiographers and doctors behind the glass. And I was thinking, wow, they must think I'm a loony bin. All these people are coming in saying, hey, have a look at this guy. He's walked in here thinking that he's having a stroke. I reckon we're going to find out that he's on drugs or something. But within a few minutes, it confirmed my suspicion that there was another bleed. And this time, about an hour later, I was met by my neurosurgeon. And my neurosurgeon said to me, well, you've avoided surgery and you've convinced me not to do it for 3 years now. But this time we have to go in. We have to remove the faulty blood vessel, because if we don't, you could have a more serious bleed and it could kill you. Are you comfortable with the operation? And of course I said yes. The risks, and doctors are really good at giving you all the risks and all the potential problems that it could cause, range from death to walking out of hospital within 2 days. And when I wake up from surgery, I could not feel my left side. And when I went to walk for the first time, a little nurse come to take me to the loo after the surgery, because I had to go and clear out my bowels, etc. And she was about this big. And she said, oh no, that's all right, sir, I'll take you. And she came to hold me and grabbed me from the waist. And as I took the first step down onto my left foot, I collapsed. It was not more than 24 hours after surgery. I let out a massive scream. And then I had some support. They picked me up and they took me to, a couple of people picked me up and took me to the loo. I was in rehabilitation. I was in hospital for a week and rehabilitation for 3 weeks while I learned to walk again. And in December last year, just before Christmas, I was allowed to go home. And since then, I've been continuing my rehabilitation and my occupational therapy. And as a result of that, I'm able to be here today and present on this topic for you. So what I want to end this presentation with is the simple fact that if you know somebody that's experienced a stroke, the services and the hospitals that look after us in Australia, specifically in Melbourne, are very well equipped to get people back into good health and to be a regular member of the community again. Sometimes it takes a little bit of hard work on the part of the patient, but we're very lucky here. And not all stories have to end in disability, and not all stories have to end with the worst case scenario.